Hello. Welcome to Legal Documentation in the Electronic Medical Record. I will be your guide today for this presentation. Physicians and nurse practitioners collect data from multiple sources, and from these sources, create a plan of care for their patients. These data are stored in medical records, either paper-based or electronic. Practices are transitioning from the paper-based medical record to the electronic medical record, which will forever change the way healthcare practitioners document patient care. The medical record has multiple purposes. First, it is the repository for documents created for patient management. This is the documentation for patients' progress after the medical management was started. It also means to refresh the practitioner's memory and knowledge and provide meaningful information to other practitioners involved in patient care. Second, the medical record supports the collection of data for business purposes. These purposes include billing, reimbursement, quality management, outcomes reporting, and public health disease surveillance. Third, the medical record serves as a legal document to be used as evidence of the gold standard of care in a legal proceeding if necessary. The accuracy and credibility of the medical record is essential to the admissibility in legal proceedings. Electronic medical records have been envisioned as a way to improve the quality of patient care by improving the provider's access to patient data, improvements in documentation, prompting of providers for question answers, tools for decision support and medical guidelines, and access to patient education materials. The vision of electronic medical records include a way to improve the quality of patient care. This improvement to patient care is important because delivering care is complex and demanding for both the patient and the provider. For practices implementing the electronic medical record, providers must realize that it is not simply a change of documentation medium. It is also an opportunity to improve documentation quality. A systematic review was conducted in order to estimate how electronic medical record affects provider documentation. This review showed that time efficiency is an important facilitator or barrier to electronic medical record implementation. Several studies showed the use of an electronic medical record increased the completeness of provider documentation, but also showed that non-essential information slowed the providers down. Clinical decision support tools contained in the electronic medical record gives the providers the necessary tools to make gains in performance, narrow gaps of knowledge, and improve the safety of patient care. These tools assist providers in making healthcare decisions, including diagnoses, for their patients. There are several pointers cited that may help providers guide their documentation to be complete and accurate while avoiding common mistakes. The first pointer is for the provider to never document an acute abnormality found during the physical exam without documenting the corresponding intervention. Secondly, the provider should never document the intervention initiated without documenting the evaluation or the response of the patient. Third, the provider should never document a body system abnormality without elaboration. Fourth, the provider should always document the patient's baseline mental status if known. Last, the provider should never become complacent with check-off assessments, remembering that documentation be as accurate as possible. The introduction of electronic medical record has been one of the most significant changes to provider documentation. It has been shown to be more legible, decrease documentation time and cost, and improve communication between providers. Other advantages include the ability to retrieve information quickly, link different sources of patient information, and use of standardized terminology. Disadvantages of the electronic medical record include not all providers being comfortable with computer technology, extensive training involved, and the expense of initial implementation. In order for the medical record to be used as evidence in a legal proceeding, it must have certain attributes. First, the record must be made at or near the time of the exam. Timeliness of documentation is critical to the legality of the electronic medical record. All entries should be made as soon as possible. Also, entries should never be made in advance. Second, the record must be documented during the normal course of business. This means that the provider needs to complete the patient documentation and sign the note soon after the patient encounter is complete. And an encounter that is left unsigned for hours, days, weeks, or months may allow unauthorized and untimely alterations and incorrect changes to the patient encounter. Third, authorship is important. The record must be made by a person with knowledge of the events. The Federal Rules for Civil Procedure quote that a legitimate admissible record is one that includes it was made by the person with knowledge of the facts and that the information is recorded at or near the time of the encounter. Fourth, the computer must be considered standard and efficient equipment. Fifth, authors and sources of information must be identified. According to the legal system, identification of the patient encounter author is important for accountability. Sixth, alterations must be noted and the original record must be preserved. The original author, time, and date constitute proof that the author amended the record knowledgeably and the statements are true. Finally, the system must contain quality checks to ensure data integrity.